Hi, I'm Dr. Hisham, and I'm here today to show you how to use my holistic oral care system at home, just the same way as I show it to all our guests here in the clinic, where yes, we have one-on-one time, of course, and we have an hour and a half for the new guest experience, so I have a lot more time to sit down and show them how to use the whole system for their own health and well-being. Usually by the time they come back for their treatment, especially if it's gum disease, the inflammation has already started to go down. So the treatment, it is to reduce inflammation and to maintain it at bay and to maintain nutritional balance and physiological balance in your mouth long term. Treatment, if required, is still required. So not talk about treatments today, talk about my holistic oral care system. The video will be in two parts because the second part I'll go into details about why the steps that I will show you are so different and so much better for you than anything else that you've ever seen before. Literally the whole thing is just totally different. You'll see what I'm talking about in a minute. So in the first part, if that's all you watch, the first few minutes, it's just how to use the system on a day-to-day basis. Take it from me basically that this works until you try it out, and then you can tell me if it works for you. So don't believe me. I want you to believe with me when you've tried what I'm saying and see how it works for you and how it makes your whole physiology and parasympathetic nervous system better and better in every way. So the first part is show you what it is. Second part, variations on the methodology, what the methodology is all about, why is it better for your whole physiology, not just your oral care, and we'll take it from there. Let's say you wake up in the morning, and obviously that's when you would use the oral care system. You brush your teeth in general, and at night you're going to bed. You're going to rest. You're going to recover and rejuvenate overnight. In both of those cases, your body is either winding down before you go to sleep, so it does not want to be shocked into sympathetic shock, into a toxic reactionary response, which is what a lot of toothpastes and a lot of the mouth rinses out there, and a lot of the buzzing toothbrushes, the electric toothbrushes, and a lot of even manual brushes will put you into that state. So you're shocking your body before it's supposed to go to rest. We want parasympathetic activation, relax, rebalance, and flow before you go to sleep. Same thing in the morning. You woke up, you've been sleeping, your body's been detoxing and cleansing, and your conscious has been knocked out basically all night long, but your subconscious is working all the time to cleanse you out. So you wake up, your mouth is dry because your salivary glands have reduced their activity. The last thing you want to do is get up and go and shock it again and then go, oh, now let's go on with my day, or let's go and meditate. A lot of people meditate in the morning. I do that as well, but you don't want to go from sleep to shock, sympathetic shock, to then try to go and meditate and say, why is it not working? Well, that step in between is so critical. It's part of what I would call the OHAC, the oral biohacking to biobalance your whole state of well-being through your mouth. That's a whole different subject. We'll talk about that later. To reset, like I said, your biological clock, your biological flow into parasympathetic mode, into relaxation mode, get everything flowing, get everything balancing. So without further ado, let me show you the system, and then we'll come back and talk about these details. Why is it better? How does it work? So the very first thing in the morning, you've woken up, have a glass of water by your bed, clean water, not lemon water, not anything in that water. If you really want something different, just put a little bit of salt in there. Salt, alkaline, yes, but not lemon juice, please, or anything crazy like that. You don't want acid first thing in the morning when you're dry. So a glass of water, drink it up, couple of stretches in the morning, go into the bathroom. You either go into the toilet or into the shower or both. As soon as you enter the bathroom, shake the mouth rinse, the alkaline mouth rinse, little pop in your mouth, squirt some in your mouth, and rinse with it. Use that time while you're sitting in the bathroom or standing in the shower or both, like I said, to activate your salivary flow, alkalize your mouth, activate your salivary flow. Saliva flow is parasympathetic vagus nerve. So rinse vigorously, gargle, as I'll show you now. Obviously continue to do that for 2, 3, 4, 5 minutes, as long as you can. It's already starting to clean. It's the same thing at night. At night, you're cleaning dirt and food debris and sticky debris that's built up over the day. In the morning, you're activating the flow, cleaning up any biofilm that has built overnight from the dry mouth that we all have. You're cleaning that debris, the slime basically, which is the biofilm, the bacterial biofilm that has grown all over and stimulating and simulating your own saliva. That's why I keep saying, don't use stuff that denigrates your saliva, that denigrates your oral skin, basically, your gingiva and your mucosa, which is alcohols, detergents, abrasives, all that junk that's in toothpaste, in most mouth rinses really, because they're all acidic. So none of that stuff. It's all alkaline, food grade, parasympathetic activating stuff. So your body knows it's food, it feels it's food. As you can see now, I'm salivating just from using the mouth rinse for for 10 seconds. Imagine 2-3 minutes of that. So we're rinsing, and I did swallow it because it's food grade, yes, but usually, of course, after rinsing for 5 minutes, you would build up more saliva. The little bit of mouth rinse that you put in your mouth will be a lot more now. You would spit it out. So spit it out, but if you swallow some, like I just did, it's totally fine. It's food. You can't do that with any other mouth rinse, by the way, or any other oral care product, because they're not made for humans. They're not made for human ingestion. Yeah, put it through your mucosa and just into your blood. Doesn't make sense to me. So we shook the mouth rinse, put a little bit in mouth, rinsed vigorously, gargled. The gargling does two things. One, it cleans the back of your tongue and your throat because of the oxidizing agents inside the mouth rinse and the xylitol. They're all active, so you want to get them back there. But also, it adds more activation of your vagus nerve, because salivary glands are vagus nerve. So when you activate those, you know your vagus is activated. When you gargle, you're making a noise and you're changing your breath and you're raising your gaze. You're lifting your head up. All these things, pharynx as well, is vagus nerve, parasympathetic nerve. Of course, as you're changing your breathing, when you're gargling, activating, like I said, the breathing, you're activating your diaphragm again, and your lungs and all that. Everything what I'm talking about is vagus nerve, all of it is parasympathetic. So this rinsing the whole thing. So it's cleaning here, healing and activating here, but it's also balancing all over. And this is just the mouth rinse. This is step one. And it's in the same time that you're in the bathroom anyway. You're sitting in the toilet or you're in the shower. You're not doing any extra time for this. Now we come to brush. So we've got this biofunctional bamboo brush. It's ergonomically designed, intentionally designed, 12 months and 27 prototypes to come up with this brush, clinically tested and repeatedly tested. You'll see how it works inside the mouth in many of the other videos I've shown, how I've clinically tested, how it falls in between the teeth and the gums. But basically, it's a bifunctional gum and toothbrush. So you're brushing your gums, not your teeth. Brush your gums, don't brush your teeth. Your teeth will be brushed anyway, and in between the teeth and everywhere else. But you must brush your gums to massage them, as in improve blood flow, to clean them, because a lot of that debris, all the slime sticks to your gums, in between the gum and the teeth, the gum line basically, in between the teeth and on the teeth as well. It's and teeth, not mainly teeth. So you got to brush all that, clean all that. And the other thing is, you're going to be applying and agitating oils. So you've heard about oil pulling. Interesting idea. I think it's good in a way, but who can do 20 minutes or 15 minutes rinsing with an oil every single day? Like I said, 5 minutes with that mouth rinse and you already feel, oh, that's long enough. 15 minutes is ridiculous, and all you're doing is one part of the whole puzzle. The point with oil pulling is it is about oil agitation. You can't put oil in there and go, it worked. You've got to agitate it. Well, here what we're doing is, one, we've got accentuated oils, multiple oils. So it's coconut oil, organic cocoa butter, totol, and many other oils, and manuka oil in that oil, plus totol, and vitamin D3 and vitamin K2, which are dissolved in the oils, plus the xylitol, plus the biominerals. So you've got a lot more than just the oil, and you're going to be agitating that in 2 to 3 to 4 minutes, much shorter time, with your brush while you're cleaning. So agitation, which is application of the oils, they penetrate through, they hold everything to adhere to your teeth and your gums, and so it's protection long term actually, and feeding and nurturing to carry through the vitamin D3 and vitamin K2 through, as well as cleansing, as well as cleaning. So it's all in the same process. You don't have to do this and that and that. So my system is oxidizing, alkaline, mouth rinse, alkalize, oxidize, stimulate saliva, then brush with oils and biominerals to agitate the oils so that they become active. Plus, there's no detergents in here. So detergents plus oil means oil is damaged. So any toothpaste that says has got oil in it is just ridiculous. It has oils maybe initially when they put it in, but it's not oil anymore now. It's absorbed in the silica and it's destroyed totally by the detergent. You understand what I'm talking about. So serum, it's not a toothpaste, it's a serum full of oils on the brush. Put a lot more than this. I don't want to put too much now because it will make me salivate so much that I won't be able to talk for the video. So put a lot more than this. And here is the magic. It's not just about brushing to clean and heal and stimulate. It is the whole posture. It is a whole state of being that changes your state into a more, like I said, parasympathetic, a more flowing state, a more relaxed state, a more resilient state. You just woke up in the morning. You're now, you know exactly what I'm talking about. You're now naked. You're alone in your bathroom. You're very vulnerable. Don't attack your body at that moment in time. Enhance it. Give it what it needs to regenerate, revitalize, and rejuvenate. Basically, this is what I'm talking about. You're standing in front of the mirror. You're vulnerable. You've had the mouth rinse already. You've cleansed out. You've excreted from inside. Now it's time to cleanse from inside and outside, hopefully. Now it's time to cleanse inside more. So now we come to the posture and the balance that you would create basically in your body when you manage your whole state as you brush and clean and what I call jiggle and wiggle inside your mouth. So stand, feet slightly apart, bend your knees a little bit, lock one hand behind your back. Don't hold the brush like it's an attack weapon, because it's not. You're not trying to attack and scrub like you see on TV ads of toothpastes and in movies and all that. It's just ridiculous. That annoys me every time you see that. Aggressive brushes, aggressive toothpaste, aggressive methodology. It's just ridiculous. The whole thing has to change. That's why I changed the brush, change what goes on the brush, and then the method you use it. So you're using it like a paintbrush, because this is a ritual. What we're doing now is a ritual to balance yourself. This is not a scrub your teeth as hard as you can, as quick as you can, try to regurgitate to run out. No, this is a ritual to rebalance every morning. So part of that ritual is the hold. So put one finger underneath here, so you can have these three fingers and your thumb to be able to rotate, and you can have that finger as a lever, so you have the ability to push gently wherever you want. It's very controlled and makes you very dexterous. The more dexterous you are, the smarter you are, the more balanced you are. So anchor yourself. Lean forward into the future, feel how out of balance that is. Lean back into the past, feel how out of balance that is. Come back into the center point, the here and now. You'll feel it, you'll go like, whoa, whoa. And of course, the breath. Take a deep breath in and anchor yourself. Feel the center point here and now. You can sway side to side if you want to, that's fine. But every now and then, feel out of balance, in balance, centered here and now. And now you start to brush. Like I said before, you're brushing your gums, not your teeth. The teeth get brushed by the bite. So angle of the brush, either upwards or downwards, so it's not flat across. This is a super soft brush. Everything's unique here. I'll talk about the details later, but it's a very soft brush, so it's meant to be a gum brush. So you're putting it on your gums and you're jiggling and wiggling. Down here, jiggling and wiggling. In the back there, on your gum, on your palate basically, jiggling and wiggling. Yeah. There's no scrubbing, there's no flicking. It's a jiggle and wiggle, a jiggle and wiggle. The bristles do the work for you. They fall in between the teeth, they fall onto the gum, inside the gum. As I said, I'll show you close up under the microscope how I do the clinical testing, and I show it to guests as well. You'll be able to see that. But it's all a massaging action of the gums, the gum line, and the teeth. It's that, it's that, it's that. Now you go slower, you want to move across, round the back, round the front, round the back. What's very important as well, which I haven't said yet, but I'm going to say it right now because I have to show it to you. There is no toxins here, no irritants, no soaps, nothing to make you go, want to vomit, spit out, and drool like we do with toothpaste. So don't lean forward, because that closes your throat, closes your breathing, closes your body. That's sympathetic fear state. This is open breathing, raise your gaze. This is what it is. It's always raise your gaze, anchor yourself. It's up, so you can open your airway so you can breathe. You want to add to that some pro tips. Make a sound, whether it's an or speak to yourself, repeat your mantras. What I usually say, I'm cleaning, I'm healing, I'm cleaning, I'm healing. Every day and in every way, I'm better and better. So it sounds weird when I do it. It's like, This is just making a sound, but I know what I'm saying. I'm talking to myself, I'm meditating, I'm making a sound to vibrate my vocal cords. The larynx basically is again vagus nerve. So this is vagus nerve, that's vagus nerve, the breathing is vagus nerve, and this whole time I am breathing. I'm not holding my breath and trying to lean over to spit out this junk, because there is no junk in here. So that's the core of the system there. You're massaging and you're breathing and you're raising your gaze. Once you're done, you swallow or spit, but do not rinse. So if you've got too much saliva, too much stuff in there, you can just spit it out gently, but do not rinse out. What goes in must stay in. It's either good for you, that's why you're putting it in every day for a lifetime repeatedly, or if it's not good for you, why are you putting it first thing and last thing in your day, every day for a lifetime? Ask that question, answer that question for yourself. Pro tip, you want to get even better with this. Raise your gaze, clean, anchored. You can swap hands. When you swap to your non-dominant hand and you fracture it with it, what happens is, one, you focus, nothing in the world matters, your whole body's like, whoa, what are we doing here? You start to create, you activate your neuroplasticity, you activate your whole neurophysiology basically. So here, all the products and what we're doing here is physiology. Now it's neurophysiology. You're activating your brain cells, you're activating your muscle cells, you're activating this whole connection between the body parts to become more ambidextrous. And the word is ambidextrous. When you are more and more ambidextrous, you are literally, not metaphorically, smarter, more intelligent, more resilient, more resistant to dementias and degradation and everything else, because your brain is working and literally growing connections like crazy. So do whatever you can do every day on a daily basis to use both hands. If you can write with both hands, write with both hands. If you can't, just practice with it. And what better way to do it? And what better time than something you're going to be doing anyway, every day, all the time. Morning and night. I'm brushing my gums and teeth here, not your teeth, remember? You're brushing anyway, you're cleaning anyway. Use that time to become ambidextrous. It'll feel weird as hell initially. Later on becomes normal because now you have built the neural connections. You are better in every single way. Remember, the whole goal is to always look better, feel better, and be better in every way possible. Use the tools, use the time to become that, to become better, intentionally and carefully and intelligently. At night, 3 or 4 times a week, if you choose to do it every day, please do it every day, but at least 3 or 4 times a week. After you've done this and you've spat out or swallowed it, do not rinse. Now you can floss in between the teeth to get rid of any little spicules of sticky fibers that the brush could not get rid of. However, the main thing that cleans in between your teeth and underneath the gum line is this brush, which is not any other brush basically that can go that deep without causing harm and only causing healing and inducing healing and recovery. So you'll clean most of the stuff. Most of the time you'll find nothing comes out with the floss, but still do it because every now and then piece of mango, piece of meat, something stringy will be there still. Remove that. So at nighttime, do floss. Morning, absolutely waste of time to floss. There's no need at all, especially if you're using this system. And if you don't do it every day, at least do it 3 or 4 times a week. There are other little variations. I will talk to you about those in the next video. But remember that anchor yourself, alkalize with the math rinse first, oxidize, stimulate, put the oils and the biominerals on the soft brush. Don't use it like a weapon because it's not a weapon. It's a healing device. It's an anchoring device by itself. Anchors you back to nature. Your arm behind your back. Lean forward to the future. Lean back into the past. Feel the imbalance. Find the center point here and now. The present. Be present. Jiggle and wiggle. So it's little circles, little massaging action. I call it jiggle and wiggle because that's what you're doing. Raise your gaze. Breathe. Open up your airway. Breathe. Make a sound. Sing it, say it, om it, whatever you choose to do. I'll see you in the second part, and I'll be back very soon with the rest of the variations, some more pro tips, and why this whole thing I just spoke about is so much better for you. I'll see you on the other side. Take care.